everyone. I'm so excited. I have Dr. Kara Glover here in the studio today. Say hey, Kara.
Hi.
This is my family sister and my STEM sister and all of those good things. And so I'm so excited to have Kara on. I feel like I kind of stalked you on LinkedIn. Like, although we were in pharmacy school together, I feel like I saw you from a post or something, and I was just like, oh my goodness, like I need to be connected with her.
Me too. I find everyone on LinkedIn.
I guess LinkedIn is the GOAT. It's the GOAT. But Kara, so I want to talk to our listeners today about your experience as a pharmacist, going into accelerated program, your experience at Midyear, and then finally securing an industry position at AstraZeneca, where you currently work as a fellow and doing different rotations. So you just completed your medical informant rotation, and now you're going into medical strategy. So we're going to talk to our listeners about your entire journey, and we're going to leave everybody with a little piece of advice based off your experience. So let's get started. So you have a PharmD from Florida A&M University.
Rattlers.
Yes, go Rattlers. So tell us a little bit about the pharmacy program. So you did an accelerated program. You don't have a bachelor's. You only have a PharmD. Tell us a little bit about the program and why, as a high school student, you decided an accelerated program over a bachelor's and then PharmD program.
Right. So I knew I wanted to do something in medicine. I knew that actually my dream was to be a doctor. I had this perfect catch line of being like a cardiologist. I was like, I'm gonna fix the hearts everywhere.
Oh.
But but I was talking to my mom and she's like, I think you should go to pharmacy school. I have a family friend of mine who went to FAM and the 0 to 6, and she was living a really nice life, really comfortable life. And
Mhm.
um it was great to see that. And I mean, I didn't really know many pharmacists then. And um I was just like, okay, I'll do this. I'll go to school. And in my head, I always knew like, okay, after I was done, I was going to go to medical school. I was like, all right, this is just like one stop to school.
Mhm.
So I applied to FAM. And first of all, FAMU, I owe so much to FAM.
Yeah.
I came from an all white area, really, in Orlando. And I needed this moment of feeling celebrated and just being
Mhm.
really embraced by people that look like me, and
Yeah.
also meeting people that had goals that were similar to mine and just strived for excellence. And not saying that you don't see that when you're at home, but I think it's a different experience when you have people that are your age that are also striving for the same things that you are.
Absolutely.
So I went to BAM and did the 0 to 6, and always in my head for the first 2 years, I was like, I'm going to medical school. But those first 2 years were brutal. Taking taking pre-pharmacy classes because it's just so
Yeah.
much at once. And
Mhm.
then you go into pharmacy school. And if I could go back, I would think, you know, how did I do it? Every moment, every year was just like it felt sluggish, but
Yeah.
then when you look back, you're like, "Wow, that flew by," but while you're going through it, it feels rough, but
Yes.
you make it,
Right.
and that's
That's
what matters, it's the end.
right. So now tell us maybe the differences between an accelerated program and then maybe achieving a bachelor's and then going into pharmacy school. So with the accelerated program, did you have to take any tests prior to going into pharmacy school?
So at FAM, if you're accepted into their pre-pharmacy or that pharmacy track, um, the requirement is that you meet these certain requirements, and that's like a certain GPA. And it's not to say that you're guaranteed admittance into the program, but you're pretty there, like if you
Hmm.
do everything that you need to do, you should be able to
Hmm.
get in the program.
And it's just GPA dependent.
GPA, classes that you have to take, you have to
And
satisfy.
and these are high school before. stepping foot into the college campus, right?
So I
Okay.
actually don't know how they determine whether or not we're accepted from high
Okay.
school,
Yeah.
but somehow we get accepted. I don't know what the criteria is there. But
Hmm.
then when you're in your first 2 years, you're pretty much signed up to say, like, hey, if I complete these requirements, I will
Gotcha.
gain admittance to the pharmacy school. So
Gotcha.
your 2 years is not guaranteed, but if you do what
Mhm.
you need to do, it should be
Yes.
like the full degree.
Ah, I see. So after those 2 years, do you have to like apply for the
Yeah.
program?
Yes.
Gotcha.
You
Okay.
formally apply with
Hmm.
everyone else. So everyone else who went and got a bachelor's, everyone
Right.
else who may have had 3 years of schooling or however many years of schooling, people that may have gotten a B farm and then came back, like I assume that they applied then too.
Right.
But you apply, you get in, and
Hmm.
so for FAM or for many of the 0 to 6 programs, it's literally 2 years pre-pharm and then 4 years of pharmacy school nonstop. And most 0 to 6 programs do not give you a bachelor's degree. Now there are 2+4 programs, which are pretty much the same thing as 0 to 6, but you get a bachelor's degree. And
Hmm.
then you have like traditional, which is someone comes in with a bachelor's or a
Gotcha.
master's and then applies. So typically that's
Gotcha.
like 8 years plus of
Right.
schooling.
Wow. Wow. Do
Yeah.
you remember having courses with people who completed 4 years of a bachelor's and then, yeah.
Yes.
Wow.
And I mean, you could tell. I mean,
Yeah.
I had people in my class that were like, I felt like I was maybe an adult, but they were real adult.
Yeah.
Like, had kids, had a family, had a whole life, and I'm
Wow.
like, I am still in my prime time of just going,
Yeah.
partying at the end of everything. So
Right, right. Wow, that's awesome. So they're pretty much three tiers of pharmacy school. The accelerated, the two, you said the two
plus
year,
4, yeah,
yeah, 2+4, and then the 8 year program.
right.
Wow. Okay, that's awesome. That's awesome. So, being in pharmacy school, taking that accelerated program, how old were you, if you don't mind, when you finished?
Yeah, I finished, I was 24 because I just turned
Okay.
25. So yeah, 24 years
Wow.
old.
Wow. A doctor at 24 years old. I bet your family was so excited at graduation and cheering you on and everything. That's so awesome. So most pharmacists, as we know, typically go into retail pharmacy. They're the pharmacists we see at CVS, Walgreens, dispensing medications. So you don't do that.
No.
So going into pharmacy school, did you know that you didn't want to do retail?
Yeah, well, we have these clinical experiences, and
Mhm.
I had my first appy, or they're called, I mean, not appy, IPPs, but there are
Mhm.
these clinical experiences that we get to do while we're in school. And my
Mhm.
first one was at a retail store, and it was at Walmart. And I was like, oh, I thought I had it. I'm a really personable person. I love people.
Yes.
But when it comes to certain people in their healthcare, they're not nice.
Yeah.
And it's a whole different, it's a different ball game.
Yeah.
I absolutely knew that that wasn't for me. I knew standing up behind a counter was not going to be for me without
Yes.
a chair. And I just didn't feel fulfilled. I didn't
Yeah.
feel like I was really impacting the patient as much as I wanted to.
Yes.
So, as I was going through the experiences that we were offered in school, I was like, "Yeah, that's no." So, I
Mhm.
did retail,
Mhm.
I was like, "That's not gonna work." I did
Right.
hospital rotation, I was like, "This is cool," but still felt like I was missing that patient interaction, and I felt like I wasn't I don't know, I just didn't feel like the pharmacist really got enough respect for all that they did. I feel like
Mm.
there's so much that you do,
Yeah.
and it's kinda like in the background, and I'm like,
Yeah.
"I can't do that." So I
You're like,
moved on.
I need this instant gratification.
Yeah,
Yeah.
and I mean, I knew certain points, I was like, "Yeah, this isn't gonna be for me. I really need something that is something that I can touch more people, reach more people,
Yeah.
really make an impact. And
Mm.
maybe my parents don't know that I helped, make sure that that commercial is, scientifically sound. But
Right.
I know the work that I do really
Right.
touches not just maybe the 1 or 10 patients you see in a day, but
Right.
I'm touching thousands of patients.
Right. Right. For sure. And that's in your current job as a medical informant, which we'll get into to how you impact patients through content and
Right.
commercials and different things. And so let's talk about how, so you knew throughout your pharmacy school, you did your rotations, what you like, what you semi liked, and what you didn't like. So did you have an industry experience during your pharmacy? Okay. Tell
So
us about that.
I
Hmm.
did a rotation on my last year. Well,
Hmm.
before then, I've actually had a lot of conversations with a lot of like FAMU alum, and
Hmm.
that's the best thing. Like the network,
Yes.
I just networked a lot and just met with people and asked them
Mhm.
what do they do, and I was really stuck on this role that's called MSL, Medical Science Liaison. I was like, I want to be an MSL. It
Mhm.
sounds great. I can, have these scientific engagement, you know, talk to people and really talk nerd talk, like just have
Yes.
talk.
Yes.
And I was so excited. I was like, this is what I want to do. So I would go on LinkedIn and just like look for any MSL that may have went to BAM. And I'm like, can I have a
Yes.
call with you?
Right.
And
Those
this is while
informational interviews are vital.
right. And I like
Mhm.
this was before. This is while I was in pharmacy school. I knew
Mhm.
that these other paths weren't gonna work. So I had to figure out something really quick.
Right.
Um And FAMU does have an opportunity where you can apply for this rotation at BMS for Samara Squib.
Mhm.
And I applied and I got the rotation and I was in medical strategy and it really just sealed the deal for me. I I
Awesome.
I loved it. And I was like,
Yeah.
yeah, this is what I went to school for.
Wow. So the networking that you did, was that I know you said you did it because you were first interested in an MSL position. So how did you secure the internship? Was it an internal program through FAMU and you saw the program and you applied for it?
So the FAMU BMS rotation, they allow students from all of the HBCUs that have a pharmacy school. You can apply, and it's a formal interview process. But um, that they were the ones that really helped. I would say, if I can speak highly but at the same time lightly, because grooming can be a very tough word. But I will say, groomed me to
Yeah.
make sure that I was prepared to be in
Awesome.
industry. Yeah.
Yeah, yeah, and that program at BMS helped you. Okay, that's awesome. So what would you say was the difference? Like, what did you learn from the industry rotations that you probably didn't achieve in some of the other rotations?
I learned that it's the soft skills that get you somewhere. It's not always about what you know. I mean, it really, you hear your parents say it's not about, what you know, it's who you know. And what I learned in industry, it's not always about who you know, it's who you know that can get the job done well or who
Right.
has the resources. So I really felt a connection to what I did back while I was in school. So I worked in real estate while I was in school, all throughout pharmacy.
Wow, really?
Yeah. So
That's so cool.
I worked in leasing and I loved it. And I
Yes,
was
yes.
looking for something to kind of tie the two. But
Yeah.
those soft skills that I learned, like how to deal with people, how to
Yes.
manage people, and how to, find what you need and what they need. So I was
Yeah.
like, this is what I'm looking for. And I mean, when you're on your clinical rotations, it's all about what you know. You
Right.
spit out knowledge
Yes.
all day.
Mhm.
Where I didn't necessarily want to spit
Yeah.
knowledge. I just wanted to make sure that whoever I was impacting got what they needed.
Right, right. That's awesome. That's so awesome. And so the medical strategy internship sealed the deal for you, and you knew that your next move was going to be medical strategy upon graduation,
Yeah,
right?
yeah.
Okay. And so how did you prepare your path to AstraZeneca? I know that you attended Midyear. Why don't you tell us a little bit about mid-year and actually describe to our listeners too, maybe what is mid-year for pharmacy, for pharmacists, and how important is it to be prepared for mid-year?
Yes. So Midyear is like the biggest conference that I would say pharmacy has. It's
Mhm.
run by the American Society of Health System Pharmacists and it's huge. It can be very daunting because there's so many people that come, but you learn so much. And for me, I knew that I needed to go because they have this thing called PPS and it's personal placement services and it's where you can apply for jobs or or fellowship positions or just learn more about companies. And to prepare for that, I knew I wanted to do Rutgers because Rutgers is the oldest pharmacy fellowship program and it's the largest. And I was really looking for a network. That was what I was
Yes.
looking for. I was like, I need a network 'cause
Mhm.
your network is your net worth. So I was like, I need a large network. And so um I applied through Rutgers and while I was on the plane going to Midyear, I made a PowerPoint of all of the companies that I was going to apply to, what the roles were, what job description that like the role had. And I just kept on thinking like, how can I tie my experiences to this role? And
Yeah.
so when I sat down and at mid-year, you if you do fellowships, most of them you're doing interviews and it's back to back to back. It's literally like 6 days of interviews.
Mm.
And you have so many companies and so many people vying for these same positions. So I I ate and breathed like mid-year. Like I I sat down, I think I had snacks, don't
Mhm.
wear heels, girls don't wear heels. If
Yes.
you do wear little kitten heels because you're
Right.
gonna be moving all day.
Right.
Um, but I was prepared. I was going through this PowerPoint that I made and I was like, okay, I know who this person is. I know who that person is.
Right.
I
Right.
talked to the fellows because they do interviews with you. So
Mhm.
it's important to have those conversations and
Right.
at mid-year you learn so much. It's not just about you being interviewed, but you're also interviewing the company because
Yeah.
you're signing up for 2 years of your life given
Right.
away to a company at half price.
Right.
Yeah.
I like the half price.
Yeah. So you better
Yeah.
like it. You better like the people that you work with.
Yes, for sure. I'd love to see this PowerPoint you created.
I will share it with you. It is
Could be could be probably helpful. Did you make like little faces, like a map of the faces and who you needed to talk to?
I had pictures. So
Yeah.
in with Rutgers, we have brochures. So every company has brochures. And
Right.
there's 19 companies that Rutgers has, and they're typically like, large pharma. So, you have
Mhm.
Pfizer, you BMS, AstraZeneca,
Right.
Novartis, all of the big pharma, and also smaller pharma too, and mid-sized pharma. So I made these slides and it would say like AstraZeneca, MI fellowship and it would have the job description and it would have highlights and I would connect
Mhm.
it to a story. So in my
Yes.
head, they asked,
Right.
why did I want to do a certain position? I knew, okay, how am I going to tie this to something I've done in the past?
Right. That is awesome. That's amazing advice for mid-year attendees
Yeah,
to create slides where you're taking the job title and the description and connecting those descriptions to stories and experiences that you had, whether it be in pharmacy school and your previous rotations, and making that relevant to the job. That's awesome.
absolutely.
That's awesome. And so, all right, you mentioned Rutgers being the oldest and largest fellowship program with 19 companies, right?
Yeah.
So, when you interviewed at Rutgers, did you interview, they placed you with a company or did you interview for those individual 19 companies with Rutgers?
So at Rutgers, you do per role. So, you know, in one company, there might be 20 roles, but I knew I wanted to be in medical because I had the experience in medical. I had that rotation. I was like, yeah, this is the place where I feel like I could use my pharmacy degree. I can use my
Right,
chemical knowledge. And I
right.
knew I wanted to be in oncology. So I was looking for big oncology companies, people
Hmm.
that had pipelines that were strong in oncology.
Right.
Um, and something I won't say I was looking for name recognition because that wasn't something that was as important, but it was definitely like, do you have the resources to back this pipeline? So
Yes.
I thought about all those things. I mean, I
That's
went
awesome.
on fiercepharma.com and was looking
Mhm.
at like the stats and
Right.
all of that, just being prepared, really prepared,
Right.
probably over prepared.
That's awesome. No such thing. No such thing. How long did it take you to prepare for mid-year? Like, was this a 3-month, 6-month process for you to have all your ducks in a row?
So mid-year, when you're applying, it's that December of your P4 year. So your last year at pharmacy school. And for me, I was preparing for mid-year since P3 year. I was really preparing to be a fellow. When
Wow.
I was at my rotations, it didn't matter what rotation it is, industry or not, I would ask them to have mock interviews with me
Mhm.
because I was just like, "Hey, you know what you're looking for. You guys have been in the industry. Like you all are pharmacists. So what are some things?" And maybe not necessarily job description or job title is the same as what I would be doing in industry, but everyone has a piece of knowledge that they can give. Whether it's
Right.
soft skills, maybe it's you talk with your hands too much, or maybe you move around too much. And those were the things I wanted to really elevate of myself. Like I wanted to get better. So I would literally have mock interviews. I would anybody who I felt a connection with saw my CV. I don't
Yeah.
care what it meant. I don't
Yes.
I remember the first time I gave my CV to someone and then it came back and there were so many red marks. I was
Yes.
like, what?
Me
Like,
too.
yeah,
That's happened to me before too. Oh, this
yeah.
is me? I put so much work into this.
Exactly, but it literally makes you better, and I think I was trying to keep that positive energy, but there are
Right.
some times where you feel like, I thought I was good," but,
Yes.
you need those people to tell you, like,
Right.
"Hey, say this in a different way, say this, like, don't forget
Right.
to
For
add
sure.
that, that's important."
For sure.
And I'm glad that I had those people around me and those preceptors or those mentors around me that kept pushing me to talk to everybody. She's like, there's no one that you can talk. Everyone has friends. Everyone knows someone. So talk to everyone and
Right.
be yourself.
Right. Absolutely. That's awesome. That's really, really, really good advice. Did you now when you were preparing, like did you prepare with a group of people or was this a very individual experience?
So I did have one a really great friend who was also going through the experience with me. She was looking into another function within industry, and we both had the same BMS rotation. So we both were feeling the same struggle. I mean, we stayed together at mid-year, so
Yeah.
it was nice to have that person to just bounce off of, and
Right.
sometimes just talk to keep our energy up. But
Yeah.
yeah, I say if you find a good group who's gonna continue to push you,
Right.
I loved it. I don't know that I would have made it without her. She
Wow.
was
Wow.
really helpful.
So why don't you tell us now about the role that you accepted through the Workers Fellowship?
Yes. So, I did accept a role. It's Oncology Global Medical Information, Medical Strategy role. So it's I knew I wanted to be in oncology. I knew that that was something that was hands down not an option. I have a really strong love for oncology, and obviously, I think everyone has been touched by oncology, but I just think it's a ever changing place to be in. Never, never too comfortable in oncology.
Hmm.
I knew medical information is really important. I knew strategy, obviously, from that experience, was really important. And I knew I wanted to get more information and more experience because I felt like those were really the backbone of pharma. I was like,
Right.
if you don't have a strategy,
Hmm.
what do you have? You
Right.
don't know the medical information. How can you
Right.
get that out there? How can you get
Right.
the word out? How can you
Right.
make sure that your physicians understand what's going on? And so I was like, this is a perfect place to be. This is the perfect place. If this isn't just the start, but um, this is the perfect place to be.
So I know you mentioned everyone has been touched by oncology, which is true, but why is oncology so important and special for you?
Yeah, I had a really close family friend who got diagnosed with cancer while I was in pharmacy school. My grandmother got diagnosed with cancer while I was in pharmacy school. And I just felt like I always had this, love for cancer, although we only have such a short little block when you're in school to learn about it. I just I felt like it was such an untouched place to be. I feel like it
Yeah,
was just not there's never enough data. There's never enough research. And um I wanted to be able to look at my grandma and look at my really that she's like my second mom. I wanted to look at her and say, like, you have an option, you have other options, you have choices. And I
right,
didn't want anyone to feel how, you know, we felt as a family when it was close to the end. And it's just like, what do you do? And
right,
you hear be the change, like, if you wanna see change, be the change, and
right,
I I knew that that's something I wanted to do. And
right.
luckily, both of them are alive today and both are
No,
in remission, and so it's a great place to be in, and it makes me feel even more that I chose the right place to be.
right, for sure. That's awesome. So do they come to you sometimes maybe if they want to understand how, about pathway or maybe
Yeah,
the clinical sense of things? Is that a question you may get sometimes from family members?
absolutely. I
Yeah.
became the family doctor, and I tell them all the time, "That was the part that I slept in. I don't know that you Like, I don't think y'all wanna ask me, but no, they do, and I think
Yeah.
that makes it even bigger, and, again, another reason that we need more people of color in these
Right.
roles because we become this expert in
Yes.
our families,
Absolutely.
and
Absolutely.
we need more of that, and it doesn't matter what area you're in, but we need
Mhm.
more of that.
Yep. Absolutely. Absolutely. That is so awesome. And so you mentioned a few terms. You mentioned medical strategy, you mentioned medical information. Why don't you go into a little bit of detail about the difference of those two roles and how it applies to a pharmaceutical company for oncology?
Awesome. So, medical information is it's a wide range of things, but when you think of medical information, it's exactly what it is. It's making sure that the clinical data that comes in, right? So the studies, um, that it's written in a way that physicians can understand it, and also that it can be transcribed for even patients. So in medical information, you're typically creating materials for those people that are out in the field that are having those conversations with the physicians. And also, you're making sure that the information that's leaving the company is correct, right? So you hear this term a lot in pharma about being fair and balanced. So we're not
Mhm.
just going to feed you everything good. We're going to give you everything that is good. And what are the risks?
Right.
So MI or medical information really solidifies that. I like to say they're the backbone of pharma. They make sure that the data that we gather from the clinical trials are placed in a way that is digestible for
Right.
most people, whether that be in the medical background or even patients.
So it seems like there's a divide between the information produced for physicians and the information produced maybe for patients. So do you have experience in both of those realms?
So I've actually helped, now most of these pieces are created by other areas of the business, but I have seen and made comments. I mean, even when I was on rotations, I saw a patient pamphlet that was supposed to be like a patient guide, and I was like, it's something as simple as page numbers. Things
Mhm.
that maybe because we're so deep in the weeds that we don't think about, but then sometimes you have to take a step back and say, like, is a patient going to know that this is the way that they need to read and then read this side and then read that side? No, we need
Right.
to put page numbers because it
Right.
helps people understand, like, okay, I read this. Now I need to read this.
Right.
There's a story to it. And some,
Mm,
I think that's where, again, being a pharmacist and having a pharmacist background is great because you have seen patients before. You know what they need, or you've been working with physicians before. You know the type of conversations that are being had. So
for
you can
sure.
really advocate from the inside.
For sure. That's awesome. That's a really, really good point that you made. Really good point. And so, what would you say to someone who's maybe been in retail and they're listening to the show and they're like, wow, I think I would really thrive in a medical strategy position, or this is something that I really want to do? Like, what would you recommend their transition to be from a retail maybe to medical strategy or MI?
I think everyone's experience, and I will probably say this a million times over, but experience is everything. So you don't necessarily have to have experience in pharma to get a pharma role, but you have to understand the experiences that you have and be able to tie it back to what the company is asking of you.
Yep.
So, like, again, when we were talking about the simple things as like a patient brochure, a patient, pamphlet, what can you say that is that the company may not understand? Like when you're
Right.
talking about business companies, maybe sometimes they don't understand the patient journey.
Yeah.
And this is something that you can give to them and be like, yeah, well, this is on paper, this is what it looks like. On guidelines, this is what it says, but this is what patients actually go through. This
Right.
is the twists and turns that people have to go through to get medication. Like that's the valuable experience that you could bring. And when you talk about it, I think passion, I always say you can be taught the job. I mean, all of us can be taught the job. We graduated college, we have experience, you have the background. A disease state, you'll learn. That's nothing. You got through pharmacy school, you got through PhD. You can learn that. That's
Right.
not a problem.
For sure.
What you can't teach is passion. You can't teach, being personable. So I think those are the things that you really have to highlight when you
Right.
want to make that transition.
Right.
Yeah.
That's awesome. That's
And
awesome.
talk to everybody. I mean, networking is everything. If you know that
Yes.
that's something you want to do, reach out, go on LinkedIn, talk to anybody who has whatever role that you
Yes.
see that you want to be in, or even things that you're not interested in. You'll be surprised if those people feel a connection with you where they will take you, hey, you should meet this person.
Yes.
Yeah.
Absolutely. That's great, 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 great advice. It's funny, and everyone will hear this throughout my show, but so many of my guests say the same thing: networking and reaching out to people and having those conversations about the types of jobs that are out there that you're interested in pursuing. And even if you don't know, just doing your research and finding someone on LinkedIn that's associated with that type of title and reaching out for information or interview. That's great, great advice. So I guess that kind of leads me to my last question. If you could list maybe the top three skills for a pharmacist or a pharmacy student tapping into industry, and top three interpersonal skills and top three skills, what would those skills and interpersonal skills be?
I would say interpersonal skills definitely be I like to say mendable, right? You have to be like Plato. There's consistent change in pharma. There's consistent change everywhere in life, but there's
Yeah.
really consistent change. The only thing that's consistent in pharma is change. So you have to
Okay,
be
and
ready.
yeah, I read.
Yeah. So you have to be ready. I mean,
Yeah.
be ready to switch on the tip of a dime. I mean,
Mhm.
maybe every morning I wake up and I write down a to-do list, and I
Yeah.
cannot tell you how many times that I've had to rewrite them in the middle of the day.
Yep.
I have to reorganize, or they say prioritize. Everyone says
Yes.
the word reprioritize
Yes.
60 million times throughout the day.
Right.
But if you get hung up on it, if you get hung up, you will literally get hung up. You will not
Yes.
be able to proceed.
Right. For sure.
So you have to be able to bendable And also be be ready to be taught. And it's not going to be in the way that you see it in school. People aren't going to teach you in PowerPoint. You're not going to learn that way. But be ready to just listen. And I spend so many times because so much of my time is in meetings, but a lot of time I'm just listening. I'm just
Right.
listening to everyone's experience.
Be
I'm
a
listening.
sponge.
Yeah,
Yep.
be a spot. Oh my gosh,
Yep.
that's the word. I use that when I applied to this position. I wrote it in my letter of intent. I was like, I just want to be a sponge. Just come in ready to learn, ready to
Yes.
work, and
Yes.
don't
That's
say no if you don't have to. Like, obviously
mm,
know your limits, but
right.
you can get an opportunity. It may not be what you think it is right away, but you never know.
Right. Right. So mendable, being able to be a sponge and absorb all that's around you to learn and really develop in your role. And what's another thing?
I would say, I mean, I preach and we harp on it, but it's network. I mean,
Yes.
while you're in there, I've
Mm,
talked to so many people at AZ. Put
yeah.
on one-on-ones, talk to anyone. You can sit down and learn so much and learn about other people's careers and their journeys to where they are. And you'd be
Right.
surprised how many of them have had such different journeys. I mean, everyone
Yes.
has a different journey to get where they are. So,
Yes.
what can you take from their journey that maybe opens your eyes? Maybe that means a new experience. Maybe it means you need to switch functions. Instead of being a medical, maybe you go to commercial, maybe you go to regulatory. But
Right.
when you have those conversations, that's when a light bulb, at least for me, that's when I'm like, oh, that sounds good. That might be an experience I want to do. How can I get in touch with someone that will help provide that for me?
Right. For sure. That's awesome. That's awesome, Kara. This was so good. You're dropping so many gems like I knew you would, which is why I had to have you on the show. But if you had one last word for our listeners, what would it be?
I would say if I had one last word, it would be
Yep.
do not psych yourself out. You are your worst critic.
Mhm.
You are
Mm.
you're already much better than what you think you are. And
Yes.
that's just because you're here.
Yes.
And I think a lot of times, then I can say, as a woman of color, as a person who came from a not so privileged at all background, I just felt like there was so much against me, but then there's also so many people rooting for me. That's something you have to keep in your head at all times. There are going to be things that don't go right, and you can't let that get you down. So
Right.
remember, you're your worst critic. So I promise you, if you think you're an 8, you're probably a 10.
Yes. Yes. That's good. Girl, I needed that word for myself.
Yeah.
That's awesome, Karen. Thank you so much for taking the time to do this. I'm sure our listeners are going to appreciate this so much. And if you're listening to this show and you found that this has been so great and you want to see Kara again, maybe in a workshop or some type of one-on-one experience, please drop a comment on the YouTube channel and we'll make that happen. So thank you everyone for tuning in and we'll be back with another episode of White Coat, White Collar. That concludes today's episode of the White Coat, White Collar podcast. If you like these discussions and want to continue hearing more, please subscribe and leave a comment on the platform that you've tuned into today. For more resources on unique career options for STEM and healthcare professionals, please follow White Coat, White Collar on Instagram, Facebook, and LinkedIn. If you love what I'm doing and would like to be a sponsor to help me continue demystifying the career landscape, please visit whitecoatwhitecollar.com/sponsor. Thank you for tuning in and all the best on your career journey. Remember, take the journey one step at a time and don't be too hard on yourself. You got this. Until next time.